Hey people, Deeb here in the RxPOSED podcast, episode 3 with Michael Sleiman, who is a member and the vice chair of the Michigan Board of Pharmacy and also a manager at Walgreens. Michael and I talk about a couple different topics, including pharmacist prescribing, point of care testing, the payment for services, and some of the challenges that are being faced within the reimbursement system, how delegation of technicians is impacting the efforts of pharmacists and those within the pharmacy profession, his experience of serving on the board of pharmacy within Michigan. He gives you some insights on his experience where he went and testified for a Senate bill recently within Michigan and what that experience was like. And he gives you also an idea of his thoughts on the decreasing pharmacy admissions within colleges and schools of pharmacy. I hope you really enjoy the episode and the discussion. I think you'll get a lot out of it. If you do, be sure to like, subscribe, and share with somebody to make sure that we're spreading knowledge. Let's get into the episode.
Welcome to the RxPOSED podcast with your host, DB.
Welcome into the RxPOSED podcast, episode 3 with Michael Sleiman here. Michael, how's it going today, man? How are you doing?
Good. How are you doing today, Deeb?
I'm doing pretty good. I know that we actually just saw each other at a conference this past week, so we got to catch up and kind of talk about, how life has been, some recent travel, some hobbies and things. So why don't you tell people who are not familiar with who you are, Michael? Tell us about who is Michael. What should the people know about you, and why should they be listening to some of the things we're going to talk about today?
Well, so a little bit of background about myself. I attended University of Toledo for undergrad, a school where I know you went.
Yeah.
I graduated in 2016 from pharmacy school, Midwestern University. I worked in retail at Meyer Pharmacy for 4 years.
Mm-hmm.
And then I took a leap of faith and decided to open up my own pharmacy.
Yeah.
And that was a very rewarding experience, and I learned a lot. But I had my own pharmacy for about 2.5 years. During that time, I was appointed to the Michigan Board of Pharmacy.
Okay.
And I ended up selling about a year ago, and I've been a pharmacy manager with Walgreens ever since. Outside of my professional career, I enjoy, going to the gym, doing these cold plunges that everybody's talking about on that you see on TikTok.
Yeah.
It's pretty cool, honestly. Have you tried it yet?
I have not actually tried the plunge. I think I've told you I tried the shower version of it.
Yeah.
That's definitely a rush. So I can imagine jumping in the tub is actually a crazy feeling.
It really is. The first time was very hard, but it gets easier.
So I do have to ask, how does that work? Do you have to like buy ice? Like, do you just keep freezing water at your house all the time? Because that kind of sounds like it's a chore to keep all that ice.
It is, especially in the summer. In the winter, it's a lot easier because it's already cold outside. So
yeah,
you don't really have to worry about it. And in Michigan, I mean, we got winter or cold for about 7 months of the year, so it's not too bad. But during the summer, it gets it can get a little bit annoying because I have to keep buying ice. They do sell these chillers for like $1,000, but I didn't want to buy one.
Oh wow! Yeah.
So I use ice, and looking forward to the winter when it's actually colder. Makes it easier.
I was going to say in the winter here in Michigan, you can honestly just run outside and jump in the snow half the time. So
yeah, I know.
That might save people $1 or $2.
Yeah, for sure. I'm looking forward to it.
Well, Michael, we're really excited to have you today on the podcast. I know that you've had an interesting start to your career. You've definitely, had some different experiences opening your own pharmacy, working as a pharmacy manager, serving on the Michigan Board of Pharmacy, which I think is super interesting and maybe an aspect and perspective that guests that are listening to this may not really know, what those things entail. So Definitely looking forward to hear more about those experiences. One thing I wanted to dive into was, there's a lot of things, as we talked about this past week and the conference that we attended, I think really highlighted, there's a lot of challenges and things that are happening within the profession of pharmacy. What do you think, from what you've been seeing, are maybe the two most pressing challenges? And what are some solutions or innovative solutions or approaches that you think that we can take to help address those challenges?
Yeah, we definitely have some challenges. I think so. I have two in mind. Obviously, the one most important, I think, that is affecting our profession is reimbursements. Over the last 10 years or so, reimbursements have dramatically gone down. Pharmacies are not making what they used to. It's why I sold my pharmacy. I would lose money on 30% of the prescriptions that I was filling. Like, just lose money, like not even make $1. Like it would be negative.
Yeah. Wow.
So I mean, it gets a little bit challenging when you're filling scripts and you can't really make money off of some of them.
Yeah.
And you see that right now with the chains. They're the layoffs and they're cutting hours and reducing store hours. So things like that. As for solutions for that, I think there's two different approaches. One, we need some sort of reform to kind of regulate, what's going on and make it fair reimbursements for pharmacies.
Yeah.
And the other aspect of it would be along the lines of like provider status, because I think pharmacists are fully equipped to do more, and they're, educated to do things that we're not able to do right now. And I think increasing prescribing ability, getting paid for services versus just the drug that we're filling. So a more expanded scope of practice. As for the other challenge, I think we've talked about this before, but the fact that we're all divided in the pharmacy profession, the boards, the chains, different chains, independents, the deans of the colleges, and our state organizations, we all kind of going in different directions instead of working together. And I think we need to, all get in a room, like somebody from each, entity, and sit down and talk about how we're going to move this profession forward. And actually, make a difference. Because you look at nurses and you look at doctors, the organizations, they work together. We, as a pharmacy, we're divided. And I think, we can take a little bit from what other boards are doing and other states are doing, such as Idaho. We learned about what they're doing, what they did in Idaho in this conference recently. So I think those are probably the two most biggest challenges.
Yeah. You mentioned a couple interesting pieces. So, I really appreciate your insight on what those two challenges are. And I would say those are ones that I have definitely heard. The second one, the first one that you had mentioned, definitely I've heard that before. The second one about being divided, I know that, again, we've talked about that in the past, and maybe it's one that people don't think of off the top of their head. So, with the first challenge that you had mentioned, I've talked to a few pharmacists, and maybe let me know if you've heard this before. Some of these older time pharmacists, or people who have really been around for quite some time, and they talked about how back in the day, when there was, before insurance, before a lot of, different, like things like Medicare and Medicaid, et cetera, existed, how, pharmacy was a cash only business. It was one of these things where people came in, there was prices that were set based on what you acquired medications for, and then you sold them to patients, and obviously you're trying to make some profit based on the pricing of the medication. So, that's definitely an interesting piece that we've moved from that style to where we're at now with, largely insurance companies and individuals hosting health insurances. And then the second part that you'd mentioned, which I want to focus in on, is expanding scope of practice. So you talked about increasing our services and the availability of what we can get paid for. So what are some things that you think that pharmacists should get paid for that either we're doing right now or that we maybe could be doing in the future?
So from the aspect of we should be able to, I think we should be able to prescribe different types of medications and treat, different types of ailments. I mean, a patient comes in and, they feel like they might have strep throat or their throat is hurting. There's no reason why we can't test for them and possibly have a prescription for amoxicillin or azithromycin based on, their symptoms. I know a lot of pharmacies are doing this already with collaborative practice agreements. I know when I was working for Meyer back in like 2018, we were all POCT certified, and we were able to do these types of tests, strep testing, even HIV testing, Hep C testing. A lot of things that, it's needed for patient access, especially here in Michigan. You have a lot of areas, rural areas up north Michigan, that it's not as easy to get to a doctor. And so having pharmacists that are trained in these aspects be able to offer these services is a real benefit to our community and our patients.
Yeah. And I think, one of the interesting things that we heard this past week at that conference that we both attended was the kind of the research and the study behind that topic, right? The point of care testing, what patients are willing to pay for right now, where in a lot of these instances, maybe insurance is not covering these things, or they may not be covered in certain aspects. And then from the prescribing aspect, obviously we heard the independent prescriptive authority side of things, right? And kind of what that looks like compared to the collaborative practice side of things. So I think you make really good points on those. I think the interesting part about pharmacy services is, and I'm playing devil's advocate for you, or not for you, for the audience, would be, but Michael, nobody has time to do those types of things. So how do we address that? There's not enough time. There's not, there's all these other things that I have to be doing as a pharmacist. How am I going to be able to prescribe and get paid for it?
That's true. I mean, that's a valid concern amongst a lot of pharmacies, especially chain pharmacies. But I mean, I think there's two sides to it. I think one, if you're able to increase services that you can get paid for, eventually in order to do those, they're going to have to give you the hours for those. I mean, but if you think that they won't, and they may not do that, I mean, it just depends on the organization. The other aspect is being more innovative and, using different technologies to help the pharmacies. So for instance, I know Meyer does this. Walgreens is starting this. It's called central fill or micro fulfillment, where, you can get half of the prescriptions filled at another facility and delivered to the store. Not having to be focused on filling 500 scripts a day and only filling maybe 250 scripts, that's going to free up a lot of time. And it's going to free up time for your technicians, which technicians should be able to help with these types of services as well, under, the delegation of a pharmacist.
So automation, or using automation, and technicians, right? So assistance with what the pharmacy and the pharmacist is doing. So those, you would say, are two things that are important to focus on in terms of how do we create that time and or how do we create those efficiencies to be able to have a team that's working with you and also automation to be able to help out. So those are what you're proposing then to help to free up maybe some of that time to move towards those services.
Yeah, for sure. Because I mean, even right now, having during COVID, having technicians trained to administer immunizations and help give COVID vaccines was a huge load off of a pharmacist, especially if you're a pharmacist working a 12-hour shift by yourself. I mean, it takes a toll, especially if you're doing like 40, 50 shots a day.
Yeah.
Having technicians be able to administer and help and do those types of services definitely reduces the workload and the burden on a pharmacist.
And you make a good point, especially with COVID, that we've seen, a difference and what technicians and pharmacists, et cetera, have been working on. Obviously, increase demand, increase, things that they're being asked to do by our patients and whatnot, or that our patients are coming in for these services. So if we think about it from a medical model, when you go to your physician or your prescriber's office, like, they have people that help them out, right? Like, there's medical assistants, there's nurses. Even when you're in the hospital, how many times do you actually see that doctor or just the surgeon or whomever it is? You're always having a team that's helping with your healthcare. And so what's the major difference in pharmacy? Do you think that it's that we're really only limited to technicians and that's the issue? Or do you think that technicians can really take on more? And what does it take to get there?
I mean, I do definitely think technicians can take on more. They are trained. I mean, like I've had technicians that I've worked with for 3 or 4 years, and sometimes I feel like they know more than me.
Yeah.
The technicians are honestly amazing, and they're very helpful, and we just need to figure out how to utilize them and not be afraid to give them these tasks. Some states and some we have regulations where technicians can't do certain things, or they're not allowed to do certain things. But I really believe it should be up to the delegation of a pharmacist to determine whether or not their technician is capable of doing these types of duties.
Yeah. Yeah, and I agree with you. And, I think there's a lot of folks out there that can probably attest to technicians that they've worked with, like you had mentioned, that are wonderful and maybe could rise to the level of, what some pharmacists are doing in certain aspects. But there's those technicians that are also like, I would never trust that person to administer a vaccine. I would never trust that person to give me a point of care test. So what do we do about those individuals? Are those people, supposed to be doing all these advanced roles, or how would you address that?
Well, I mean, so it goes back to delegation. And if I, like, for instance, if in my pharmacy, I feel like I have a couple technicians that are not, fully trained or not, I wouldn't necessarily trust, doing certain tasks, then I wouldn't be asking them. Either I would do it myself or I would ask another technician. But I think we also probably need to make the pharmacy technician job more of a career for technicians. To like make it a more rewarding field for them to work in, because we have a technician shortage problem, and part of that is pay, and it's just they can go work at McDonald's and make the same amount. Like it's not. We need to basically treat our technicians better and make their job more rewarding for them.
Yeah, no, I agree with you. Yeah. Making it into a career, making it something that's, that they can also train and learn and feel like they're growing in their profession. And it's something that, they want to stick with. So I think that those are really all good points. So the one thing that I wanted to ask you about, specific to Michigan, since I know that you had some involvement in this and it does relate to exactly what we're talking about right now, some of the things that we've discussed was, This past year, Michigan had Senate Bill 219 that came through. And I know you and I talked about this in the past. The bill itself started out as allowance for pharmacists to be able to administer vaccines independently under their own authority. So prior to this bill passing, pharmacists, there really wasn't much language within Michigan. It was via delegation, via the collaborative practice that we had been talking about earlier in terms of, the services. So this bill now allows pharmacists, or is going to allow pharmacists, to be able to independently administer and order vaccines, and also to be able to independently order and administer a few point of care tests out there, which I think it includes stuff like COVID, flu, and other types of viral infections, etc. So tell us about how you got involved with testifying on behalf of, the profession of pharmacy to the legislature on this bill, which is extremely, extremely impactful and important. Tell us about that process and what did it mean to you? Why did you think it was important as a board of pharmacy member to testify? And maybe what advice would you give to somebody in another state who has that opportunity, or even if they're not on the board, if they have the opportunity to testify?
So, I mean, as for the process, it started with conversations that I've had with our regulatory affairs team at Walgreens, and then them putting me in touch with the government affairs team. And I do have some relationships with our local state representatives. And I heard from his side and also the independent side that they're working on this bill. And they needed, they were trying to get 1, 2, 3, like a bunch of things included in this bill, like different tests that we can test for, and obviously immunizations. And so I started by, having these conversations and putting some of these people in touch with each other. But really it starts with working with your state representative. They, have a voice, and working with the different government affairs teams with different organizations. And everyone kind of being on the same page. We kind of had these conversations with a few different government affairs teams, like from, say, Meyer, MPA, Walgreens, and we kind of all kind of agreed that this is something that we want to move forward with. And that goes back to, the issue that we talked about earlier, being united. I think with this bill, we were somewhat united. I mean, we could be better, but we were somewhat united. And it kind of helped push this bill through. And so that was kind of how the process was. As for why it was important for me, I mean, one, it was a very rewarding experience. It meant a lot to me to be able to do something that I felt like made a difference, and talk to our state reps about expanded scope of practice and what pharmacists should be able to do because they've been doing it for all these years. As a board member, I mean, I think it's important because, one, we're involved in the rulemaking process. And so if the House or any of the state reps had any concerns with, how this would be implemented, I thought, I would be able to answer those questions. I thought also me kind of being in like a Walgreens pharmacy, like I'm a pharmacy manager, so I see firsthand how this would impact pharmacists. And so being a board member and being in the same boat of a lot of pharmacists, I'm able to, share that insight to the House of Representatives and the people that I was testifying in front of. You asked me a lot of questions.
It's okay. I was going to say it was like a 3-for-1 question. So,
Yeah.
the last piece that I would ask is, what advice would you give to someone in another state or anybody out there that's watching this that, has never been involved in that and wants to make a difference in, this area?
Yeah. My advice would be get involved, talk to your legislators, talk to your state reps. Some of them don't know much about the pharmacy profession. And so they need to be educated on what's going on in our profession. And once they're educated, it can make a big impact, especially if they're able to educate other state reps. And then you have, them on your team. That's honestly how we make a difference. People think that, as a board member, we can just do whatever we want or make whatever changes we want. But in reality, it starts with your legislators. It starts with getting involved on the government affairs side. And we were lucky because my state rep was a pharmacy technician. And so he understood how a pharmacy works. He understood what goes into a pharmacy. Like, he worked for 2 years as a pharmacy tech. So he had a different insight.
Yeah.
And so he was a very big advocate for pharmacy and getting other people on our side. But yeah, definitely get involved, see how you could help, work together, develop some bills that will maybe help advance our profession.
Yeah.
But talk to your legislators.
Yeah. And I think that's a really important piece that you had mentioned, is to have those discussions, right? I think that's where it starts. A lot of people don't have the discussions, or a lot of people don't know where to get started for those discussions. And as you mentioned, I think one of the most important pieces was working together with other groups, other, people, to make sure that you were on the same page, or at least probably as close as you could get, right? Like, not everybody's always 100% on the same page, but that's definitely part of the process, is working together with others. Because if we're talking to the legislatures, or people are going and visiting and, testifying, and everyone's saying something different, they get confused, right? Like, they're thinking, why are all these different groups saying, some of them are saying yes, some of them are saying no, some of them are who knows, proposing to, do X, Y, and Z. So I think that's another really important piece too, is making sure to work together and try to get on the same page.
Yeah, we need to be aligned.
Yep, exactly. Let me ask you a side question on that, just because I know that this sounded like it was your first time maybe doing this. So how were you feeling, I guess? What was the feeling leading up to going into that room?
It was definitely nerve-wracking. I mean, for me, I get nervous.
Okay.
So, and I probably haven't had a lot of public speaking experience.
Okay.
Which is why I'm putting myself out there and trying to do those types of things. So it was nerve-wracking for me.
Yeah.
But at the same time, it was a very rewarding experience. And after doing it, I would definitely do it again if asked, for sure.
Gotcha. Okay. No, that's fair. I mean, I feel like most people would probably be nervous in that scenario, naturally, but I wasn't sure if you were just like, oh yeah, I walked in there like Hulk Hogan and ripped my shirt off, and I was like, yeah, let's go, and that was your feeling, or if you were really like, oh man, this is actually like kind of scary to do.
No, definitely not. Yeah, it was scary. I'm not gonna lie, it was. But as the conversation went on, as I started speaking, it got a little bit easier. And having gone through that my first time, I think if I were asked to do it again, I wouldn't be as nervous, because the experience that I've had and knowing how the whole process is.
Yeah, I gotcha. Yeah, and like you said, having the experience now, I bet you when you get to do this again, probably not if, but when, you'll probably hopefully feel a little more comfortable next time. Maybe you will put on the Hulk Hogan outfit. That way they'll remember, everything that you said.
Yeah, for sure. For sure.
Do you want to switch over just a little bit here? Because I know that this is also another, kind of interesting, I'll call it controversial / hot topic area. Over the past few years, and we just really looked into this again, I know I keep mentioning this conference like it was like something crazy, but it actually came up at the conference, which was that, pharmacy school admissions continue to decrease. That's what some of the data that we were looking at that conference was showing. And I just wanted to hear what your thoughts are on, obviously being a more recent graduate, having gone through pharmacy school within the last decade, and just kind of seeing things from where they were to maybe where they're going. What kind of impact do you think this is going to have on maybe the profession or jobs or things like that in the future?
Well, yeah, the decreasing pharmacy school admissions is definitely a concern. I think it stems from the profession struggling, and that goes back to reimbursements. Pharmacies not, making money the way they used to, not being as profitable. And it just, they're also, the other side of that is the workplace environment. So a lot of people are concerned about, pharmacists burnout. Pharmacists are not having enough help. They're working them too hard, and things like that. So I think that's scary for a lot of students.
Okay.
And they're steering away from retail pharmacy. I know there's a lot more pharmacy jobs that are remote, where they can work from home, or they're working for insurance companies. But I do think it's a concern. There's another side to it, and I don't think it's necessarily in Michigan. So like Michigan, we've had for the longest time our 3 pharmacy schools. And I think that, definitely heard of impact on some of those schools. And so it is a concern. But there's another side, I feel like, and it's not necessarily in Michigan, but maybe in other states, is people are talking about shortages, but I don't necessarily think that there's a pharmacist shortage. I think there's just areas where pharmacists may not want to live, or because a lot of pharmacists that I talk to, they're struggling to find jobs, especially in our area. The Detroit metro area, they're struggling to find jobs, or they're having to drive, 2 hours to work, because it's those certain cities or certain areas, rural areas, that are struggling to fill pharmacist positions. But because like if you look at maybe 10 to 15 years ago, I don't know, maybe you have this research, but 10 to 15 years ago, how many pharmacy schools were there versus how much there are now? Obviously Michigan hasn't changed, but other states have changed. Like there's states that have like 7 or 8 pharmacy schools that 10 to 15 years ago, they only had like 3.
No, good point. I think, some of the information we were provided this past week at that conference was I can't remember the exact timeline. It was maybe 15 to 20 years, I want to say, but the pharmacy schools went from being 80 to 142, I believe, is approximately where we're at. So it almost doubled within that span of time from, approximately, I would say 15 to 20 years in the past.
So, that's a lot. That's a lot of schools. And that's a lot of pharmacists that are graduating, but yet we have a short. It's interesting. I honestly, it's interesting that there's a shortage, but there was so many people graduating from pharmacy school over the last 10 years.
Yeah, and I think the interesting piece is, from what I recall, it's been since 2010. Actually, the amount of people who have been applying for pharmacy school has been decreasing for almost like 12, 13 years now. So it's
Really?
not something that's new, it's something that's actually been happening within both of our times when we were in school. So it's something that has been happening over time. And obviously, COVID probably had an impact on a lot in terms
For
of
sure.
hiring, in terms of remote work, like you had mentioned, opportunities that are open or maybe closing, etc. And one thing that I think I pointed this out hopefully at the conference, but there's a lot of stuff happening outside of pharmacy too, right? Like think about, I think birth rates, in the United States, especially, like birth rates have continued to decrease. People are not having kids or as many kids as they used to. There's not as many people just in general, maybe that would be interested in going to college, right? Like think about people who are doing different types of jobs these days, like dancing on TikTok or, making,
Influencers,
influencers, or, the stock market
real
people,
estate.
real estate. Yeah, there's a lot of other opportunities that have opened over time and probably will continue to open, right? So maybe you're also seeing people going into those fields or looking at, cybersecurity or something and saying, I can go to school and become a coder, or not even have to go to school and make six
Yeah.
figures and stay at home. Like,
Yeah.
why would I go to pharmacy school?
That's true.
Why would you do that when presented with some of these other options that are out there?
Yeah, definitely. No, that's a good point. They're exploring these other opportunities because they can make the same amount or more without having to go to school.
Yeah.
And it's interesting. It's interesting what's happening.
One other follow-up I wanted to ask you on this, because I think it is an interesting piece as well, is since there are less people applying to schools overall, so like each school has less people that they are getting in their pool, right? So they are accepting I think what it was, like 90% of people now are getting into pharmacy schools is what was presented this past week.
Yeah.
So 90% of people now are getting into pharmacy school when they're applying. That's a very high rate compared to, it was like 30% or something when we were applying. It was a little bit different. But if you're accepting that many people, do you think that people who are graduating now are lower quality candidates? So meaning that when they go into the workforce, they're not as prepared, or maybe they're not as experienced in terms of like people who knew what they were getting into. They were just like, oh, let me go to pharmacy school, it's easy to get into. Like, do you think that that's also having an impact on people who are coming out of pharmacy school more recently?
Yeah. I definitely can say that I see that firsthand.
Yeah.
That because these schools are also trying to fill their seats, they're accepting all these students, like you said, 90%. That's extremely high number. Acceptance rate. And so I definitely think it's affecting the quality of pharmacists that we have out there. There's a lot of them that I've worked with that sometimes I ask myself, I don't know how they went to pharmacy school. And it's frustrating because it also diminishes our profession. And it's a challenge. It's definitely a challenge. And I don't have an answer for that. I really don't. I don't know, but it's definitely true. I definitely see, pharmacists that are not they're not good quality pharmacists.
And not never. I wasn't anticipating getting to the age where both of us are at now, where we're the old guys in the room saying, back in my day when I was in school, or, back when I graduated. But it's almost kind of like getting to that point, where there's pretty drastic differences that are occurring out there in the workforce.
I know it's crazy, and I'm only been out of school for 7 years.
Yeah, right.
So it's crazy.
Yeah. Well, Michael, I want to move into just one last topic here. So an area that I know that we've talked a little bit about, but I think people would really want to hear more about would be, what types of things or initiatives or rules have you been working on or worked on with the Michigan board? What are the topics and areas that you guys have been looking at? What are some things that you've been examining, from a board of pharmacy perspective?
Well, one in particular, post-COVID, obviously we just talked about, people going to remote jobs or wanting to work from home because they realized that, that they can during COVID. And so one thing that we discussed as a board and we are moving forward with is allowing technicians and pharmacists to work from home. The big one was technicians, because technicians couldn't work from home, and they weren't allowed to do a lot of different things. And so allowing technicians to work from home or work remotely, and they can do, data entry, they can do insurance billing, they can process prescriptions, those types of things, is going to be helpful and more desirable when they know that they're able to work remotely every once in a while. So I think that'll help it'll help technicians want to possibly have a career as a technician. Another aspect, because this is our biggest issue, is the shortage of technicians, is making it easier for pharmacies to hire technicians, making it easier to make it easier for them to have the employer-based program at their pharmacy, where they can get technicians licensed themselves without having to take the national exam. They can submit an exam to the board, and as long as they hit all those bullet points, they can get technicians licensed through their program. We talked about lowering the age of technicians. That would be able to enter into a program. Obviously, technicians can't work until they're 18 or get licensed until they're 18, but they'll be able to work in a pharmacy under a technician training program at age 16 or 17. And that way, high school students that are interested in pharmacy can explore that while they're in high school. And so I think that's going to help a lot of pharmacies and being able to hire, because I used to get questions all the time, can I hire a 17-year-old? And the answer was usually no, because they can't get licensed and they have to be licensed.
I got you.
But if you have that training program, you'll be able to hire them through a technician training program.
I got you. Okay.
What else? We've talked about, expanded scope of practice. Obviously, this bill that just passed, as a board, we're going to have to develop rules around that.
You're talking about the Senate Bill 219, right? Like the immunization point of care testing?
Point of care testing, I mean, that's going to be huge for pharmacy. Being able to test and prescribe.
So you guys, you've looked at a lot of stuff with technicians. It sounds like remote work, trying to make maybe that aspect more desirable, a little more flexible for people to be able to, number one, to hire, to maintain, and also maybe open up opportunities, that have been doing in other states for years. And we've obviously seen during the pandemic that, remote work and that sort of thing can be very useful for pharmacies and individuals and patients to make sure that they're getting the care they need. Expanding scope with, the things to come with that immunization point of care testing bill. Are you guys looking at anything in terms of, controlled substances or like central processing? I know you had kind of mentioned that as well earlier.
Yeah.
Are those things that you guys are looking at as well? I know that some other states have been looking at those too, or like automation.
Definitely. Due to, the advancements in technology, we had to develop rules around central fill and central processing, and what a pharmacist can do, what a pharmacy technician can do, and what they can't do. What was the other one you said?
Controlled substances or automation?
Yeah, controlled substances. I can't think of anything off the top of my head, but the one that comes to mind in Michigan, at least, was gabapentin being a controlled substance in Michigan. I believe it's only a controlled substance in 7 states. Correct me if I'm wrong. But we talked about removing it as a controlled substance in Michigan due to the burden that it causes on the pharmacy being a controlled substance. Every time you have an annual inventory, you got to count like thousands of gabapentins. And if it's not, the quantity is not double written, it's not a valid script. There's a lot of different factors that came to play, but that was one of them.
Yeah. I think you guys were looking at like allowing for automated devices like pickup lockers or kiosks or something like that, right?
Oh, yeah, definitely.
Because you had a pilot program come through, right?
Yeah, we had a pilot program for pharmacy kiosks in a pharmacy or outside of a pharmacy or in a doctor's office that would allow patients to fill prescriptions without a pharmacist present. So pharmacists, it's basically like telemedicine essentially, because pharmacists could talk to patients, like they could counsel the patient on their prescription through video, like we're doing right now. Through that kiosk. Obviously, it wouldn't allow for controlled substances. We're not there yet, just for safety concerns. But I think that increases access and makes it's easier for the patient, especially when they're leaving the doctor's office. If they have one of those kiosks outside the doctor's office, or say, the pharmacy is closed on the weekends or something, they can access their medications through that.
So just kind of looking at how automation can also play a factor, with helping for some of the services that patients are looking for as well.
Yeah, for sure. With AI and everything that's happening right now and the technology that we have, I'm sure there's going to be a lot of things that we can probably do to help the profession or make it easier for patients and pharmacists. And the pharmacy team.
We'll have robo pharmacists, come out to the aisles and punch people and give them the right medication
and give them vaccines.
They'll chase after people with shots. That would be like I feel like that's like a sci-fi movie that someone's got to make. So Michael, we're coming to the part of the interview that I like to conduct here, which is the fun part, which I call the hot seat. So how this is going to work is I'm going to fire off 5 questions quickly to you back to back. Your goal is to just not have to think too hard and answer with, something with, you can answer with your yes or a no if it's that kind of question, or I would say try to keep it to like 2 to 4 words or a sentence if you absolutely can. So some of these are going to be hopefully some interesting questions for you. So are you ready for the hot seat?
Let's do it. All
right, here we go. Michael, you are now on the hot seat. What is your favorite item to buy at Costco?
That's a good one. My favorite item to buy at Costco.
Don't think too hard.
I would probably have to say,
He's thinking of his whole pantry right now.
because I just went to Costco, so like I just got a bunch of things. They're protein bars. I love they have a specific brand of protein bars that I really like, and so I have to get them from there, as well as protein shakes.
Protein bars, protein shakes. What advice, or excuse me, would you advise students in high school to go into pharmacy as a career path moving forward?
Would I advise pharmacy students to go?
Would you advise students in high school to go into pharmacy as a career path moving forward?
Definitely. Yes, for sure.
I was going to say that's a yes or no one.
Yeah.
Are cold plunges just a fad?
No, cold plunges are really beneficial, I believe.
Should pharmacy regulators look to move towards standard of care practice enforcement style?
Yes.
What is your next planned vacation destination?
My next planned vacation is, where am I going? Actually, I'm going to Vegas in a couple weeks.
All right, there you go, Michael. You are now off the hot seat. Congratulations.
Thanks, dude. That wasn't too bad.
Yeah, it's usually a mixture of fun stuff and a little bit more serious stuff here and there. So just like to hear your take on things. So where can guests find you or connect with you if they're looking to if you have any social media pages, if you're on any social media websites, books, etc. Is there anywhere that they can find you at, or if they're looking to learn more about you?
Yeah, I would say the social media platforms that I'm most active on are LinkedIn, Instagram, or Twitter, or now it's called X.
Yes.
So those three I'm pretty active on, and if anybody has any questions or wants to reach out, I'll gladly reach out to you.
Sounds good. And then the final question for you. In your journey as a professional, what do you think has been the most significant lesson you've learned? And what advice would you give to others who want to make a positive impact?
So the most significant lesson I learned is the importance of getting involved in networking.
Mm-hmm.
And, pharmacy is a small world, and, you never know when you're going to need a favor from someone, or, someone can help you pass a bill.
Mm-hmm.
So definitely networking and getting involved and doing it at a young age. Like it starts, in pharmacy school.
Mm-hmm.
Get involved with different state organizations, get involved with APHA, things like that.
Mm-hmm.
Meet new people, and you eventually, we can help move the profession forward.
Mm-hmm.
When people network and understand each other, and that starts early on.
Awesome. That's a really good advice, and I would actually echo some of the words that you said, especially getting involved, getting to meet people, and building those relationships.
And having a good mentor too.
Yes.
Having a good mentor to bounce ideas off of, or ask questions, and to learn as much as you can.
Yep, exactly. And we're getting to that age where we're going to be those old guys that'll be maybe mentors for others. So maybe someone will look to us to be their mentor.
Hopefully.
So Michael, I want to say it's been a pleasure. Thank you so much for your time. I think we had a really great discussion, and people learned a lot today, hopefully. So with that, we will close the episode. Any last words for the guests, Michael?
No, just thank you for having me. Thank you guys for listening. And, if you ever do have any questions, don't hesitate to reach out.
Sounds good. All right, Michael, you've been RxPOSED.
All right. Take care, Deeb.
Thanks.
Thank you.
Thanks for listening. Be sure to like, subscribe, and share to support future guest interviews and content.